Hello everyone, and welcome to Health Law Talk presented by Shahardy Sherman Williams. Before we get started, please be sure to subscribe to our podcast and follow us on Facebook, Twitter, LinkedIn, and YouTube, linked in the description below. We hope you enjoy this episode.
And good morning, everyone, or good afternoon, depending on when you're listening to this. This is another Health Law Talk episode with Conrad, Meyer, and Rory, Bellina. Rory.
Good morning, everyone.
And today we're doing part 2 of our series under COVID and mental health. And Rory and I have been talking about this. We think it's a very timely issue. And we've had part 1 with adolescents. Today we're doing part 2, COVID, mental health, and adults and families.
Yes.
And so we have 2 special guests with us today, Felicia Kleinpeter and Christopher O'Shea. Are they on the phone? Felicia?
Yes. Hey, good afternoon.
Okay, so we're going to go ahead. Yeah, good morning, good afternoon, whatever time you're listening to this. Felicia, why don't you go ahead and introduce yourself to the audience and give a background about what you are, what you do, and give the audience an idea about how you handle mental health.
Thank you. My name is Felicia Kleinpeter. I am the co-founder and chief executive officer at Imagine Recovery in Uptown New Orleans. Imagine Recovery is an outpatient mental health and substance use treatment facility. And I am, to be transparent, I am a person in long-term recovery from substances and mental health issues. So I, have a good perspective on helping people get through things, having been through things, and service, adults and families here in our center and, on the phone and things like that. Fantastic.
Christopher, what about you?
Hey, everybody. Christopher O'Shea. I am a co-founder of Imagine Recovery in New Orleans and the co-founder of TPN Health. I have a background. I have an MSW. I am a combat veteran from Afghanistan and Iraq, and I'm also a person who has been living his life coping with mental health.
Well, Christopher, thank you for your service.
Yes, thank you.
And just for the audience purposes, give a brief background. What does Imagine Recovery do?
Imagine Recovery, we have treatment programs, intensive outpatient, and soon a level of care called partial hospitalization. So people come to us with substance use issues, mental health issues. We have group therapy, individual therapy, psychiatry, family sessions, family education, family support, those kind of things. So some people go to treatment, residential and go away. We are in the city in real life. You come to us on a weekly, for 10 weeks, 12 weeks, sometimes longer, and let us help you to, get on a better mental health track, get skills, connect, find community, and all those things.
Very, very interesting, and thank you for that introduction. So I think we could just jump right in. Today's recording date is September 17th, and Louisiana, at least, is in its 4th wave of this COVID-19 pandemic. I think we'd like to start out with talking with you, Felicia, and Christopher as well. Let's talk about going back in time, right before COVID hit. What were you seeing with your patient populations? And then as COVID hit, can you kind of walk us through what transitions you saw and what different issues did you see pop up?
Would you like me to start?
Sure. Absolutely.
Sure. Okay, so thinking about right before COVID hit, whenever you say that, it's like I take this really deep breath. We were seeing, people came in with mental health issues, certainly, and alcohol issues, other substances, and people were living in the world and sort of, as we would see normally, people have issues, and so we were able to treat a real broad population with that and help them achieve, a life worth living and all of that stuff. When COVID hit, it shifted to some degree. People immediately started experiencing more mental health issues. People that didn't necessarily have one before, didn't identify as having anything, that came to the forefront right away. With the isolation, anxiety, fear, and all those things, depression, being so isolated, those really came out to the forefront. And then fairly quickly, because of those things, we started seeing more alcohol abuse, substance abuse, just to try to sort of snap out of the way one was feeling in this isolation.
And I guess one of the things that we'd like to know is, so let's talk about, the immediate impact of COVID, which you sort of addressed just momentarily. So what did you see now? We're almost a year and a half later. Right. What are the differences are you seeing now, present day, from a year ago when COVID first started and you started seeing these mandates and lockdowns? We're going to shut everything down. No more school, no more in person. Now it's mask mandates, 6 feet. Kids can't go here, there, and now even vaccine mandates. In some schools.
Sure.
And also how is that affecting the adults and the families? What are you seeing a year when it first started and then present day?
That's a great question. Christopher, why don't you start with that?
Okay. So I would say.
Uh-oh.
We just lost Christopher.
When this began, we all basically thought maybe a few months at worst. And I think the exposure, as well as a ton of the economics that began affecting everyone, you always have to look at the economic side. But a lot of it's fear, the unknown for any human being, and especially those whose mental health starts getting triggered, as well as caregiving. We all had to shift into these different roles within our own communities and families. So as an adult, that falls on you. I see a lot of fatigue. I see a lot of people who are just at a point where their mental health is just so worn down. And that's developing into many other issues. The instability of the political system, the economic system, all of that overall is always going to trigger underlying mental health as well as existing mental health for people.
And I don't disagree with that. I think we've heard on the adolescent podcast a similar situation where things have progressed. So I guess the question, let me tee it off to both of you, is some therapists that we have talked to have said that in the initial lockdown that they've seen not just negative effects, but there were some positive effects. Like kids were focused. They seemed to disassociate maybe from some negative friendships and were able to focus more. And so can we contrast the negative effects? Did y'all see positive effects initially, and have those transitioned to negative effects? What have you seen in that dynamic?
I'll take that. That's interesting. There were some positive effects from COVID. There were, people whose professions take them, on the road a lot, whether it's, musician friends of ours or people that travel for work regularly, or even people that just go away to work, right, from the home. Now, kids are at home, families are at home, kids are doing telehealth, adults are working on their computers from home. And that gave a lot of people time to really get to know their families, spend more time with their animals, spend more time outside, really bond and connect. So there were some positive things. I know musicians, let's say, whose careers have taken them on the road for 30 years and have never had 1 year to be home with their kids and their wives, So there were some positive effects. I think there were a lot of challenges when you mentioned initially kids no longer being able to go to school. I mean, we have friends with younger children that they're having to homeschool and keep them focused on, over Zoom. That can be difficult. I know something that we implemented here right away was to do a virtual parenting class, like some dialectical behavioral therapy skills, because all of a sudden people are having to homeschool or, be at home all the time. So there were definitely some positives and some negatives. And I think we've all navigated through this very well. And I know something that we had to implement here is move very quickly to find solutions and find support for people.
I understand. I can see that. I can understand that. That seems to reflect what others were seeing in the adolescent world.
Christopher, I have a question for you. So if we go back and talk about the various mandates that we have, what did you see, if any? Let's talk about the mask mandate first. What effects, if any, did you see on your patient population? And in addition to the mask mandate, if they were forced to work from home or be socially distant, or couldn't go to their usual gym or couldn't go to a restaurant or a bar that they like to go to, what kind of effects did you see with adults when COVID kind of started and we had the most serious lockdowns per se?
Yeah, I mean, it's interesting to bring that up because, when the initial lockdown, one of the positives that came was some of the things Felicia had said, and as well as you had mentioned, that all of a sudden you started to look at what's important. I think any crisis, especially one that is a pandemic, forced people to start to think what's the important priority. And so I do believe that, like, going to the gym or being able to go to a movie theater or any of the things that immediately were taken away, I think all of a sudden people shifted and began looking at, different forms of enjoyment, recreation, intimacy, interaction, which, I got to tell you, we all are always worried about technology. But without technology, I wonder where we would all have been when the mandates were forced onto all of us.
And Christopher, I've had a few therapist clients contact me, unfortunately asking for referrals for divorce attorneys because the lockdown where, they were, husband and wife or spouse and spouse were away from 9 to 5 or one had a traveling job, one didn't, and then they're stuck at home, both working virtually. That had a big, they weren't used to being together that much of a time. So how did you see that affect, Felicia, how did you see that affect your population?
Well, we did see that to some degree. And we know just from being mental health professionals that there was a large rise of, abuse in the household where, that kind of thing was happening. And if someone's not going away, like you're saying, there's a lot more separation, which kind of made the relationship manageable. So we did have some instances where people that were forced together for so long did not fare well together, and so decided to part ways or get counseling or get treatment or whatever to make the situation and the relationship last. One thing that I wanted to comment on your last question with the masks is it's been an interesting process as far as the mask mandates. I believe there was a lot of resistance at first, or kind of like, we'll do anything we have to do to get through this. And there was a lot of resistance on our clients' part initially, let's say, when we were able to, we're still masked, in our building the whole time as a health provider. The staff is masked, the clients are masked, they're all vaccinated. But am I going to be able to connect with people sitting in a room with a mask on? And am I going to be able to? And what we have found is, yes, that we absolutely have. It's just become the new normal, And so also something to consider is there's, people that are traveling this journey of recovery, whether it's mental health or substances, it's about being selfless kind of thing. So even if I'm vaccinated and I know I'm okay, I put on my mask because I'm thinking of others. I want to protect other people. So I think a lot more people have kind of gotten into that mindset that I don't want to create fear in other people if I'm walking around not masked. Does that make sense?
It makes sense. I mean, I guess the flip question to that would be, well, if you're vaccinated and you're wearing masks, then so what? I mean, you're already vaccinated, and I'm not trying to politicize this, but in a sense, that's the flip question that what we have is we have calls from clients and they'll say, well, wait a minute, I'm getting calls from my employees who say, well, I'm already vaccinated. Why do I have to wear a mask now? Right. So that's the flip side. So when someone says that from a mental health standpoint, how would you counsel someone and say, okay, I hear what you're saying. What would you tell someone if you heard that comment?
I could answer that, and I think there's, like you said, it's not political. It's very much what Felicia indicated, which is it's a way to alleviate in a community response, less stress on you. If if you look at the question, when it comes to why people are wearing masks or not wearing masks, the truth is you have to wear a mask. We've been doing it now off and on for a year and a half now. We spend way too much time discussing whether we should or shouldn't. It's the least important thing of what's going on.
Right.
And yet it is the flag that we all go to look at. So I understand that. But to me, there's so many other more important issues that are happening and destroying communities and as different racial groups and economic groups. Those are the things we should be focusing on, not whether I should have to wear a paper mask.
I understand. And
additionally, excuse me, I just wanted to point out, there was that short window of time where we thought we were all safe, the people that were vaccinated. So we went around without masks. And then a lot of us got the Delta variant, fully vaccinated, wearing masks all the time. So we're still able to transmit this thing. It's just in another form right now. So I feel like we're at the same place we were at the beginning as far as the necessity and requirements to wear masks and keep ourselves safe and others safe. So, that's where we are right now.
So let's pivot for a second. So I mean, obviously we have a mental health crisis going on right now with COVID for various reasons, right? We can all agree to that. So when you both, what advice would you give our listeners to say, okay, what are the signs and symptoms that a family or an adult is beginning to have sort of a mental health problem or issue or crisis related to these COVID measures? What should people look for?
Felicia?
Oh, I would thought maybe you'd want to take that one.
Sure. And
I said it to both of y'all. So, Chris, if you want to take the first part, Felicia, I want to hear your thoughts. So, Chris, go ahead and take that question.
Yeah. So, what's interesting is even prior to COVID's outbreak, the last few years, mental health has become less and less of a in the background topic. The nation began embracing it, the world's embracing it. So there were good indications that you could talk about mental health, you could talk about stress, depression, anxiety, and you weren't looked at as odd. I think what really, it goes back to the other question where you talked about what's happening among families when they were forced into this situation, having to live together in such an intimate way that they weren't comfortable. It's normal for people to feel uncomfortable in a routine in their relationship is disrupted the way COVID disrupted that. And as Felicia said, and you guys know, it definitely resulted in some people divorcing or separating or whatever it may be. But I think when you come back to what should you look for, it's the same thing you would always be looking for. Isolation. Are they becoming very angry over very non-important issues? Are they being oversaturated by watching news and editorials? And are they becoming very polarized in something to a level where they begin arguing with people in the family? Sleeping obviously has always been a big indicator when someone in the house is sleeping all the time. Their eating habits, not just not eating, but also only eating very unhealthy foods all the time. So there are lots of simple ways to notice it. Would you know by talking to a friend just the average of up and down that we all have? And then on the opposite side, becoming over analytical and being the helper. I think what we didn't notice was the helpers who are way too codependent, way too connected to being that person in their relationships and their community, burn themselves out. Caregivers, secondary caregivers, all of those groups are the highest levels of suicide ideation, substance use, increased misuse. So I think indicators are that you would look for is, isolation is always a big one. The other would be outbursts of emotional, deregulated emotions, being too intense over a subject that isn't as important as it should be. Those are indicators.
So, sure. So, Felicia, did you want to add anything onto that?
I thought that was a great answer. I agree with Christopher. And typically what we would tell families is any pretty drastic change in behavior, change in communication and all of those things. But I agree fully with what Christopher said.
So if you're seeing, a friend, family member, loved one, what are some good resources available for adults? Or, what's kind of the first step if you think you've got someone who's having a mental health issue going on? Whether it be your spouse, loved one, or a friend. I know that's a very delicate topic to talk about with friends, but kind of what's that first step that we should take?
Well, there are. Christopher, did you want to go first, hon?
No, you're already in. Go.
Oh, okay. I heard you take a breath. We here are available. I mean, there are many resources online. There are, suicide hotlines and mental, on our website, imaginerecovery.com. We have several crisis line numbers and all of that. I recommend reaching out to a treatment provider, a mental health professional, to find out sort of like what the signs and symptoms are, what's available to help. I feel calls all the time for people that just are looking for something. It has nothing to do with my center. Just how can I help point them in the right direction? Call a psychiatrist, make an appointment, call a mental health therapist, just to get some support, because it really is difficult to navigate without any knowledge. What are the next steps to take? How do I approach that person? How can I appear loving and helpful, which is the intent, without being accusatory, like we're worried about you or being overly dramatic. So I know Christopher earlier and I were talking about Tulane School of Social Work has a website with research and resources for COVID. We do on our site, and there are some other places you can go. Christopher, why don't you chime in?
Yeah, I was listening to Felicia talk, and I wanted to get to a place where as a human have I been able to share something that I wasn't willing to share that was going on for me. And I think it really comes down to, if you have someone in your family, give them the space with some empathy, some compassion, and more importantly, share what your own struggle is. I mean, Felicia's in long-term recovery as well as I am to substance misuse and abuse. And so what makes that system work so well, peer support systems work so well, and it translates really easy to families and friends and even coworkers, is when you empathetically share your own struggle, it immediately can trigger that response from someone to say, hey, I've been dealing with that too. And so that's the initial thing. I think any normal person, whether you're a truck driver, a professor, a banker, if you can look at yourself with someone you care about and think of your own struggle, because we all have it right now, that's always the best way to start opening the door where they may share with you. And then once they share with you, the procedures Felicia talked about, whether it's a online group to join, the biggest thing that we recognize today is the lack and sense of community. And there are ways in which you can engage. They're not as good as in person, but they're also not as uncomfortable. So there is some positives that have come from this using technology. And if you don't have that ability, because that's the thing we see within New Orleans, there are lots of people who don't have internet. They don't have laptop computers. They may have a cell phone. There are other ideas. One of them is that we do is get someone to go out of the house. Let's go for a walk. Let's do something that moves the body. And that moving the body is another thing we're realizing during the pandemic, that if you can get people to do dancing or shaking, it's unlocking them a little bit so that they might be able to share what's going on.
So let me ask you this. I've heard, and let me ask you both these questions. Would you both agree that there is a lack of capacity in terms of mental health providers for the need?
Yes.
Yes.
Okay, so if we can both agree, if we can all agree to that, in other words, we know there's a lack of capacity in terms of the providers, what would you tell the family, the adult, the individual who might not be able to afford a therapist, who might not be able to call a psychiatrist and make an appointment and get in quick enough, right? Where do they go? What's available for them in terms of a community support or a resource-based support for those individuals?
There are many services in New Orleans, for example, that work on either free treatment programs, sliding scale treatment programs, Medicaid programs. We refer a lot to places that will take somebody for free, that may make for therapy charge $18 an hour on a sliding scale. So there definitely are places and systems that are in place for people. There just aren't necessarily enough of them. And go ahead, Christopher.
Yeah, I mean, no, your point's 100%. So Felicia's right about that, but even those places that we have these relationships are backed up. And they're that's always been the story, but during the pandemic, it's even worse. As far as psychiatry goes, even if you're paying for one, it can take 4 weeks to see one right now. So, I mean, these are the real things, so we talk to all these reasons. Someone comes to you and says, I need help. You get them a psychiatrist, and that psychiatrist says, I don't have an appointment for 5 weeks. So, we all know, we actually dealt with that recently with someone who had all the abilities to pay, and it still didn't matter. So that's really, really a huge issue. And as far as community, the community has stepped up, whether it's churches, synagogues, community areas, our Buddhist center here. There's lots of different groups that are doing it, but more importantly, I would say right now, telehealth has made the economics a little easier on everyone's side. So that's one of the benefits, I think, of telehealth is if we can get it to a place where people in those populations who can't afford $20 even an hour can get services. I think that's one of the directions we need to move.
Christopher, you read my mind, because my next question was going to be about telehealth. So, Christopher and Felicia, Christopher, you brought it up, but both of you, I'd love for you to chime in. Talk to me about how your practices pivoted to telehealth, when the pandemic hit, the pros and cons of trying to provide therapy through telehealth, because in our previous episode, we definitely heard about some barriers of not being face-to-face. And then I'd love to hear the pros about it as well, and then, how you'd like to see it continue to evolve in your practice.
I'd love to take this one first. I have to say, as the, operator of Imagine Recovery, when we learned of the lockdown was coming, I have to say telehealth has been an absolute, for lack of a better term, godsend. We were faced with a situation where our whole business would shut down. Our clients wouldn't have services. And literally in one day, we were able to, get a HIPAA compliant Zoom platform, figure out how to do breathalyzing and drug screen over telehealth, do individual therapy sessions and group therapy. And so our clients that might have just been without telehealth, they would have just been at home without any support, any education, any guidance. We're very quickly able to just, okay, it's Monday, starting on Wednesday, you're going to be sent a Zoom link. We help them all figure out how to log in, how to download the app, how to do all that. And basically seamlessly, we're able to serve them. Now, the great thing about telehealth too at that time is you could see people's faces, because in your own home, in your own private space, you're not having to wear a mask. So it's been an incredible opportunity for us to be able to continue to serve people. What I would like to see moving forward is, some insurance companies or law, state to state laws are prohibiting, let's say I have a client that just now evacuated to another state, right? A Tulane student. Doing that state to state telehealth. There's certain times where that's allowed and then they pull it out, but just being able to open up the services so that people can have state to state therapy, which is reimbursed and also, legal. So that's what I would like to see.
Sure. Now, Christopher, did you find that when you had to pivot to telehealth, did you find that you had the same effective therapy sessions, or was there something missing there between the screen?
I really appreciate this call. I've thought a lot about this. And I can tell you, as a person who's like the Hair Club for Men president that's also a client, I myself, began having to engage as a person in long-term recovery on recovery meetings online. And so personally, I was very skeptical. And I ended up getting a huge benefit. What we've determined, though, is people who are just now engaging in therapies and mental health support, their reaction to it is not the same as someone who has maybe a few years or time in person. And I think also there is something about physical presence, no matter how much, we're big believers in education and having a bright therapist, a smart therapist, and an aware therapist. But there is something that's not tangible that exists when you're sharing a space in a room, as well as getting in your vehicle or on the bus and going to a place and sitting with others. There's something that to this day we still haven't yet identified, but there's something that's healing about that, right? So that's never going to be replaced by the actual virtual. The other thing that I found was, even though I like Felicia's attitude about seeing faces, I can tell you as a person who works in therapy that not seeing someone's body, their physical presence, I lose indicators on, are they plugged in? Are they involved? So in therapy, I think there's a downside to that. On the upside, like Felicia said, I think there were lots of people who during the pandemic had a severe amount of anxiety about going out in public and being out in public. This helped alleviate that. So, we didn't make them come in person. That was interesting. Felicia did something where we have enough space in buildings that for people, we wanted them to get out of their houses during the pandemic. Mm-hmm. So she would allow them to come and stay one person in separate rooms at our facility and join virtually. So we saw a much healthier uptick in the people that we did that with than the people who just stayed in their homes. There's all kinds of research that's been out about, what are the downsides? I think what Felicia said, the other part of that is it's allowed people cross borders and states to realize their issue was there were people from all over the world and all walks of life. So there was some of that, which I think was good.
So a couple of follow-up on that, Christopher. So let me ask you this. So you mentioned earlier about not being able to see body language and body cues when you were evaluating your patients. How much of that would, and this is to both of you, Christopher first, what do you think, how much of that is involved in your assessment of a patient's condition?
It's interesting. Felicia will actually be better at this question than I am. I can tell you this, that body language and the levels in which all therapists have become educated in the last 5 years is a lot more important than we realize. Psychiatry has used it for many, many years. It's a big part of their training. But for us, I think it's a real indicator. It's also difficult to see if they're actually looking at you on a screen. You think they are, but they may not be. I think all of that plays a role. I think the biggest thing that Felicia will probably answer is we do a tremendous amount of research on your past history. And so I think a lot of the information is really being processed that way. And then we usually do have a psychiatrist, a psychologist, and a social worker analyzing the information that you've given us. So it's important, but I think you just have to spend more time than you normally would.
Understood. Felicia, you want to follow up on that?
Yeah, I agree with Christopher. Body language and physical presence is really important. It is an important factor, but when we're talking about telehealth, it was just a great substitute, and also, let me say this, being in person also helps somebody not have distractions because clients aren't allowed to have phones in the group room or in their session. So when we're on telehealth, as great as it is and as valuable as it's been, you can tell people are looking down at their phones or they're doing this or doing that. So there's upsides and downsides, certainly. But I think people's body language says a lot about them when they come to therapy and sort of their general, presence. So that's what I think.
So real quick, let me ask you this spot question. Okay. What percentage of your patients did you see via telehealth pre-COVID? Christopher?
I think less than 1%.
Felicia?
I'm sorry, could you repeat the question?
Absolutely. What percentage of your patients pre-COVID did you see via telehealth?
Zero.
Okay, so let's the follow-up, obviously. What percentage of your patients now do you see post-COVID? Christopher?
So we're probably at about, we do individual in person, so I would say probably about 80%.
80. Wow, that's a tremendous.
That's a big shift.
Right. Okay, Felicia, what about you?
Okay, I'm going to give you a timeline. And when COVID came, it was 100%.
Okay.
When we were able to come back in person, we have 1 out of 4 groups that's still virtual and some individual therapy and psychiatry. But here's the thing. When people evacuated and we couldn't be open, our center didn't have power, 100% telehealth. So it's like being able to kind of shift and move, but knowing that it's always there to say, we don't have power, it's going to be on Zoom. So it does shift and move, which having the opportunity to do that is incredible.
Great. Okay. Yeah. Okay. So let me ask the follow-up to this. Okay. So capacity-wise for both of you, okay, what, in terms of, I don't know if you put in percentages or in terms of the number of patients, but what has telehealth done in terms of your ability to see numerosity, the number of patients, and can you quantify that?
Sure. I'll start. Our mission, what we believe, Felicia and I, it didn't really matter. Obviously, it was easier, and you could have larger groups if you choose. We don't, because to us, the capacity level of the therapists that are in, some of our groups have 2 therapists in them. Our whole thing is there's a number you get to where a person isn't getting the value. So even though we had friends who owned other facilities, they were like, I now can have 40 people in a meeting, in a group. That to us seemed irresponsible. And so, for us, I think the group size didn't shift. I think what Felicia can share on is it did allow us versatility for those people who couldn't actually physically come to see us.
Got it. Okay.
Yeah. It increased our ability because as a facility licensed by the state of Louisiana, we're able to treat anyone in Louisiana. So it did increase our clients from Baton Rouge or Thibodeau that maybe once may have driven here, but they were able to join every day from their home. So being able to service people from other cities besides New Orleans increased.
Gotcha. That's a really good point. And I think that, like Conrad mentioned, telehealth is only expanding, and so it'll continue to allow you to reach more patients. And like Christopher said, the newer patients are just so accustomed to doing things virtual. So,
well, I think once you open the box, I mean, remember the red tape we had with telehealth before this, and so we remembered. Right. I mean, literally within days, CMS came out and just cut all the red tape.
It was gone. Yep.
I was like, for years we've been looking at this and saying, well, how long before the? So I guess now the cat's out the bag. I mean, you can't put the toothpaste back in the tube.
And the issues before where you had to have a certain software and it was very expensive. It had to be run on.
Then you had the licensure and reimbursement.
You had to have servers that were HIPAA compliant.
Right.
It was
overnight
astronomical.
Yeah, and overnight you were able to go to consumer products. So I think that's great, and I'd love to hear from both of you. Going forward, we're like I mentioned in the beginning of the call, we're kind of in our 4th wave, and it looks like we're coming down from that. But going forward, where do you see your patients going? And I guess my question means, what issues do you see that are going to continue, or what issues do you see will go away for your patients, and kind of how can you predict, what's coming next, I guess, for you?
From a COVID standpoint?
From a COVID standpoint, yeah. Do you see that, more people are getting vaccinated and more people are getting kind of accustomed to this new world, per se, where things are more spread out and you have to show a vaccination card in certain places? Where do you see your patients or new issues going from here?
Three.
I'm thinking, actually. Do you want to take it first?
Okay.
Just pondering.
I'll answer. So So I'm glad we're bringing this up. The first thing that's really starting to happen is when I talked about people's fatigue, it's also trauma. This is a traumatic thing that we're in that you don't begin to really process until it starts winding down or stepping away. I think the other aspect is we all had this dream that there would be an end date for this thing and the world would return, right? And that we all know now that's not going to happen. I think in regards to when we talked about people who maybe sought out mental health during this period of time for the first time and really engaged in it, I think what's going to be interesting is when it is beginning to be back in person, the anxieties of that. You know, you've gotten used to conveying whatever you're doing, whatever form of therapy you're doing, or community group, through a lens of a screen in your own home. Now you physically are in the presence of others. So there's going to be some interesting positives and negatives that are going to come from that. Felicia and I both have been talking a lot about this. We would like to be able to, continue using the option of telehealth, but also maybe hybrid versions where there are some people in a group and some people on the screen. So I think there's options that have come out of this traumatic experience, and I'm going to stay positive on that. I think also in rural areas, you can now have access to better therapy. Because if they can do it over virtual, it allows them, as Felicia said, within a state to maybe go and be a part of someplace. Obviously we think our place is amazing, right? And so, there are positives out of this.
Excellent. Felicia?
Yeah, I would like to say just addressing the telehealth and being able to continue to do it. It's really important that insurance companies support it and on from here moving forward forever continue to reimburse for it. I can't imagine what would happen if they just decide one day to say, sorry, we're not doing that anymore. So just putting that out there. When I see changes in people, people have different issues now. I think when Christopher brought up economics before, I look at, people that are in different careers now than they were before the lockdown started. They had to, their business was shut down, their livelihood was shut down. Which is why we have a lot of restaurants and stuff like that looking for staff. People that once worked somewhere now had to move on to something else. So, and I think in those people's lives with new careers and different economics create different stressors. And so the things that people are facing, will always have a certain degree of anxiety, depression, ADHD, substance use. But sort of the causes and conditions maybe have shifted a little bit. And I believe as this, ends, quote unquote, ends, and people are back in person, there is that level of anxiety that Christopher talked about and trying to get back into a comfort level, reattaching to other people and reconnection. There's been such a long stretch of kind of not doing that. It's like, with the first time you went to hug somebody, it was like, wow, this feels odd. I don't remember how to do that. You know what I mean? Of course, you're wearing a mask and all that. But so I think there's some reintegration and a lot of the skills that Christopher mentioned, the mind-body medicine skills, the mindfulness, the dancing, the walking, just connecting with other people is really, really important to get back into a comfort, how to engage back in the world, post-COVID.
I agree, and I guess let me ask you this: we could do a whole show on insurance reimbursement. I mean, we could do multiple shows on that, and I'm sure we'd have some very interesting discussions about that.
Yes.
So let me ask you this: both of you have brought up a lot of topics, a lot of good points for families, adults dealing with this mental health crisis with COVID and a lot of things going on. So I'd like to ask you, what can you give our listeners some tangible resources, whether it's a website or something they can go to for more information to help them with getting the help they need?
Felicia?
Well, off the top of my head, I can say, I wish I had a bunch of things written down. I would give Imagine Recovery a call. Me specifically, I'm going to verbally tell people my cell phone number if you don't mind. It is 225-937-1132. That's my cell. I am available you can call me, text me. I can point you in the right direction to resources, whatever your needs are. Christopher and I are very fortunate to have national relationships and colleagues. So whether you're calling from New Orleans or some other state, we can help you with that. Like I said, on our website, there are crisis lines, there's suicide hotline, Tulane School of Social Work. There are many, many places to go. And I know Christopher has some he wants to share.
Well, yeah, I mean, I think, I was talking to Felicia when I saw that this was something that, we want to give to your listeners as well as anyone who listens down the road. Felicia's website, which is imaginerecovery.com, at the top, there are all different current updated resources for every type of human being and different topics, dealing with race and COVID and economics and COVID and every other aspect. So that would be a good website to go to. There's also, if you go online, most universities in every major city have taken on the task putting out local resources for the community. So if you live in wherever you're living and you're listening to this podcast, think of the university near you and go to their website, and you will find very updated information. And the whole key here, guys, is the updated. Secondly, like Felicia just did, she put her cell phone out there. You also hopefully will find a site or people who will get on the phone with you and direct you in the right direction.
Well, I appreciate it, both of you. I mean, I think Rory and I would both echo that.
Yes, very informative. Thank you so much for everything.
Everything. This has been a fantastic show. We want to really appreciate you taking the time to come on and really tell our listeners about some of the things they can do and things that they see with COVID. And also, I mean, very importantly, about how telehealth has changed your practice and your outreach. I think that's and really the access to the services that I think people so desperately need. So to all our listeners, we really want to thank Felicia and Christopher for coming on the show. If you like the show, please hit that subscribe button. Make sure that you subscribe to our podcast channel. We're going to be coming out with a part 3 on COVID mental health, dealing with the elderly. And so we'll have some special guests dealing with elderly folks and how they're dealing with COVID and mental health. So thank you, Christopher. Thank you, Felicia. We really appreciate you coming on the show. And sit tight for a minute. We're going to wrap it up right here.
Okay.
Thank you for listening to Health Law Talk presented by Shahardi Sherman Williams. For more information or to contact us, please visit our website linked in the description below. Also, please be sure to subscribe to our podcast and follow us on Facebook, Twitter, LinkedIn, and YouTube linked in the description below. Thank you for listening.